Okay, hello, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. Everything you see is magnified 30 or 40 times on the screen. And we're going to start off just looking towards the back of the knee. Okay, so as we look in this medial compartment, hold this for a second. Table up a little bit more if you can. I got it for a minute. Okay, so hold the camera here. So as we look in this medial compartment, we can see the posterior horn here. And we know the meniscus is torn right in here. There's a split right there. So we'll open up the fast fix for starters, but here you can see the split right there. All along here, this entire back wall is split. So we're going to get to work fixing that. As they open up those instruments, I'm going to look at the rest of the knee. This is the anterior cruciate ligament. That actually looks pretty good. And then the lateral compartment. As we look here, this is exactly what we suspected on the lateral side, which is a little bit of chondrosis. You can see here, but not too bad. So we'll just put a shaver on here for a second just to make sure that that's not unstable. We'll show you some more in a minute. Okay, so here we are just using our shaver on this lateral plateau. I just want to make sure this cartilage is not unstable. We're not trying to remove anything. And I don't think there's anything else unstable, so there's a pretty good idea of what we've got here. The meniscus is fine, no signs of any significant tearing there. So now we'll come out in extension and we'll look at the patellofemoral joint. Roll his legs up like that. We'll show you some more in just a minute. And as we look up here, we can see some cracking in the lateral facet of the patellar cartilage here. I don't see anything significantly unstable initially. Pull that off, yeah. Go ahead and take the outflow off of that. So that looks, although it's cracked, it looks pretty stable at this point. We can look at the trochlea, and you can see some areas here as well. This type of cartilage appearance and kind of early degenerative change is something that we use our orthobiologic injections for quite a bit, whether it's platelet-rich plasma or bone marrow-derived stem cells. But I don't see anything else to do here. I don't want to remove anything that's not loose. So let me give you that. We'll take the shaver in here. And that's really all I think we need to do here. So we're going to go off in the video, get back in the medial compartment. So what you can see here is this little guide. It allows us to come in here and plan where we're going to place the implant. I think for the next one we'll probably use curved up. You can open that now, I think. Okay, so we're going to start here. Hold the camera here. Okay, there you can see the beginnings of the device just working its way in. And with this first stitch, I'd like to get a little bit farther away. Now what we're going to do is tighten this down. Let's show you some more in just a sec. I feel like I'm starting to pull pretty hard. Let me see this real quick. Okay. How does this release? It's just tight. Okay. There we go. Yeah. So we're going to go ahead and cut the suture tail now. And you'll see our little cutter slide down. Just like that. Okay, and so that's the first stitch. We're going to place another one almost certainly here. We're going to probe that for just a minute. Okay, so we've passed another vertical mattress stitch here, and now we're just going to cut this. Okay, and now when I let go of the knee, we've got that meniscus repaired posteriorly with 2 mattress stitches, and hopefully that'll do the trick. It'll keep it stable, give it a chance to heal. The root back here is fine, and the body, the rest of it up here looks pretty good. So I'm happy with that posterior meniscal repair. We will give that a chance to heal and get you back to the recovery room in just a little bit. So good luck to you now. I really hope this does the trick. Bye-bye.